Frenzy, Associate Professor in Mental Health Nursing. We have got many psychiatric disorders seen in the childhood and the adolescent group. So we have got the ADHD disorders, childhood autism, hyperactivity disorders, so, mental retardation. Okay, we have got emotional and behavioral disorders in children. So very few treatment option in terms of psychopharmacology that we use for treating these mental or emotional disorders which are seen in children. Okay, so in the few drugs which are used in the treatment of the childhood psychiatric disorders are one of two drugs. So today I'm going to discuss about the drugs which are used in the treatment of the childhood psychiatric disorders. Number one drug which is used in treatment of the childhood disorder is the clonidine, right? So the drug clonidine we use in certain indications, right? So first one is the control of withdrawal symptoms from opioid use. We have got the adolescent group of the teenagers who abuse various drugs. So in those cases, to control the withdrawal symptoms of these groups of opioids, this drug clonidine is used. It is also used in the Tourette's disorders, control of the aggressive or the hyperactivity behavior in the children with the ADHD, and also it is used in the autism. So these are the indications of clonidine. Moving on to the mechanism of action. So how this drug is going to act. So it has got the action of alpha to adrenergic. It has got the action of alpha to adrenergic receptor agonist. Okay, so that is what the action of clonidine is, wherein this drug is going to act on the presynaptic receptors, and it is going to reduce or decrease the release of these neurotransmitter into the synapse. Thereby, it will decrease the sympathetic tone, and it is going to reduce or slow down the arousal. So that is what the action of the clonidine is mainly on the alpha to adrenergic receptor, presynaptic neuron, wherein it's going to decrease the release of these neurons into the nerve terminals. Moving on to the dosage of the drug. So the usual dosage of the drug is 0.1 mg, which is given orally twice a day. That is the starting dose of the drug. The dosage can be raised to 0.3 mg a day to appropriate level later on. So that is the dose of the clonidine. So usually we start off with a 0.1 mg to a maximum of 0.3 mg. That's the dose of the clonidine. Moving on to the side effects of the drug clonidine. So like any other drug, so clonidine also has got its own side effects. Number one is the dryness of the mouth as well as the eyes. The child may seem to be irritable, fatigue, sedation. The child may also experience dizziness, hypotension, nausea, vomiting, as well as the constipation. So these are the side effects of the drug clonidine. Moving on to the nurse's responsibilities when the child is on the clonidine, very, very important. Number one is, since the side effect is it is going to cause the hypotension, there may be chances that suddenly there may be a low BP in the child. So monitor the blood pressure of the child, and immediately you have to stop the drug if you notice that there is a decrease in the blood pressure. Since another side effect is dry mouth, so you have to see to it that frequently you encourage the child to rinse the mouth, give a good oral hygiene so that the dry mouth can be prevented. That is about the drug clonidine. The next important drug which is used in the childhood psychiatry is the Ritalin, otherwise called as methylphenidate. So this is one of the most common drug which is used. So methylphenidate group of drugs, we have got dextroamphetamine and pimolin. So these are all the group of drugs which are symptomatic drugs which are used in the childhood psychiatry. Let us see the indications of this methylphenidate. It is used in the attention deficit hyperactivity disorder. Number two, it is used in narcolepsy conditions when the narcolepsy is done. So this can be used. Third one is in case of depressive disorders. in case of obesity. So these are the indications of the drug methylphenidate. Moving on to the mechanism of action, very important. So I told you these groups of drugs belong to the category of symptomatic drugs. So the direct effect of these symptomatic drugs is going to act on the alpha and beta adrenergic receptors when it is going to stimulate these receptors. And as an indirect action, so these symptomatic drugs cause the release of these neurotransmitters, that is the dopamine as well as the norepinephrine from the presynaptic nerve terminals. So that is the action of the symptomatic group of drugs directly as well as the indirect mechanism of action. Moving on to the dosage of the drug, the usual dosage, we can call it as the starting dose of the drug is 5 to 10 mg per day. Orally, it can be given. The maximum dose which can be given is 80 mg per day. So that is the dose of methylphenidate. Moving on to the side effects of the drug, we have got anorexia, dyspepsia, weight loss, slowed growth, dizziness. We've got insomnia, nightmares, dysphoric mood, tics, as well as the psychosis. So this is the side effects of the methylphenidate. Moving on to the nurse's responsibility, when the child is on the drug methylphenidate, you're going to assess certain things. So you're going to assess the mood, right? So since there are changes in the mood, dysphoric mood, so you're going to find out the mood of the child. You're going to assess the level of activity of the child. You're going to assess for the degree of the stimulation as well as aggressive behavior. So these are things that you're going to do an assessment when the child is on methylphenidate. At times, the child may become very aggressive. The mood is very much dysphoric. You cannot expect how the child will react to the various stimuli. So keep the environment safe from injury. So that is another important nurse's responsibility. The third responsibility is, since there is a chance that the child may have a side effect of insomnia or nightmare, see to it the drug is at least administered 6 hours before the bedtime so that the child may not have these problems related to the insomnia as well as the nightmare. Another important risk is responsibility is, at times you may have to give a drug called as the holiday in the children. So a holiday is nothing but it is a time period of a break that you will be giving from the administration of the drug. It should be periodically attempted under the supervision of the physician just to see how effective the drug was in the child, or whether a child requires a higher dosage of the medications. So you give a break, okay, that is called as a holiday, right? So you give a break to know how effective the drug usually was working on the child, whether he requires any kind of an extra dose of the drug. So that is going to help in determination of the dosage and the treatment. Okay, so that is about the holiday. Another important thing that you have to ensure to find out if the child is having any delayed effects of the drug methylphenidate or the Ritalin, and usually educate the parents that the therapeutic effect of the drug takes about 2 to 4 weeks. So the parents should be having enough patience with them to not to be in a hurry to see the improvement in the symptoms of the child, right? So you always give a reassurance and give education to the parents that the drug will take its own time for about 2 to 4 weeks in the child to see to it that the child is showing some kind of improvement in his behavior. So give the education to the parents to reduce their anxiety and also educate them to comply to the drug therapy. Other important education that you will be giving as a nurse to parents is to not to abruptly withdraw the drug. Abrupt withdrawal can result in various symptoms or the reactions in the child. So under the supervision or under the consultate instructions, the parents has to stop the drug, taper down the dose, and then the psychiatrists are going to stop the drug. They're going to determine whether the child requires an additional dose or is it enough for the child. So educate them not to stop the drug abruptly without consulting with the psychiatrist. So this is about the nurse's responsibility of methylphenidate. So very important in case of a childhood psychiatric disorders, very few drugs we use. Okay, we don't give many drug therapy in the children, rather we go for various other therapies. So if it is very much needed, we administer very common drugs of clonidine as well as the Ritalin, with as methylphenidate, which are commonly used drug in the childhood disorders. Right. So hope you all have understood the topic.